Why is orbital decompression surgery necessary for TED? Imagine feeling like your eyes are pushing forward, making everyday tasks uncomfortable or even dangerous. That's often what happens in thyroid eye disease, also known as TED. This condition is linked to autoimmune thyroid disorders, especially Graves' disease, where the immune system mistakenly attacks tissues around the eyes. This causes inflammation and swelling behind the eye, increasing pressure inside the eye socket, called the orbit. When pressure builds up, it can cause serious problems that need careful medical intervention. One of the main reasons for orbital decompression surgery is to prevent vision loss. When tissues and muscles behind the eye swell, they can press against the optic nerve, which carries visual signals from the eye to the brain. This compression, known as compressive optic neuropathy, can cause rapid and permanent vision loss if not treated promptly. By removing small sections of bone from the orbit or reducing orbital fat, the surgery creates more space, relieving pressure on the optic nerve and protecting sight. Another key reason is to reduce the bulging of the eye, called proptosis or exophthalmos. This outward protrusion results from swelling and inflammation, making the eyes appear prominent and sometimes causing difficulty closing the eyelids fully. This can lead to dryness, irritation, and even corneal damage. Orbital decompression helps reposition the eye back into a more normal position, improving both appearance and comfort. Patients often experience pain, pressure, and discomfort due to the increased orbital pressure. The surgery alleviates these symptoms by decreasing the pressure within the eye socket, which can significantly improve quality of life. It also helps prevent the exposure of the cornea, the clear front part of the eye, which can dry out or become injured if the eyelids cannot close properly because of the bulging eyes. Protecting the cornea is essential to maintaining healthy vision. In some cases, thyroid eye disease causes inflammation and fibrosis of the eye muscles, leading to misalignment and double vision. While orbital decompression mainly addresses pressure and bulging, it can also help improve eye positioning, reducing eyelid retraction, and sometimes easing double vision. Additional surgeries on the eye muscles or eyelids may be needed later for optimal eye movement and alignment. Orbital decompression is usually reserved for moderate to severe cases, especially when vision is at risk or symptoms interfere with daily life. It is typically performed after the active inflammatory phase has settled, unless there is urgent optic nerve compression. The procedure involves removing parts of the bony walls of the orbit or orbital fat through various approaches, including minimally invasive techniques via the sinuses, which can reduce recovery time and complications. In summary, orbital decompression surgery is a vital treatment for advanced thyroid eye disease. It helps prevent permanent vision loss by relieving pressure on the optic nerve, reduces the bulging of the eyes, alleviates pain, protects the cornea, and improves overall eye function and appearance. If you or someone you know is dealing with symptoms of TED, consulting a healthcare professional who specializes in eye and thyroid disorders is essential for personalized care and safe treatment options.